Birth control causes infertility.
False. Birth control does not cause infertility. Usually, for most birth control methods, fertility will return very fast. The only one that has a prolonged or delayed return would be use of Depo-Provera.
You can't get pregnant after 35.
You can get pregnant after 35. The idea of 35 is just our fertility starts to decrease our mid 30s. And with that, you worry about increased rate in miscarriages.
If you're healthy and exercise, you won't have fertility problems.
False. While you're healthy and you exercise, that's great for overall health and pregnancy outcomes, but you can still have all of the fertility causes leading to infertility.
IVF means twins.
So IVF actually has the lower multiples rate. IUI has the higher multiples rate now. Complete reversal from years prior.
Egg freezing guarantees me a baby in the future.
Unfortunately, no, because one egg does not equal one embryo, does not equal one baby. So you will never know the potential of that egg until you actually make an embryo.
Stress alone causes infertility.
Stress can contribute to decreased outcomes, but it wouldn't be the sole factor of infertility. However, in fertility treatment cycles, we recommend patients try to minimize stress.
Men's age doesn't matter for fertility.
So men's age does matter. It just happens way later than in women. So mid 30s, we start to see female fertility decline. In men, maybe mid 40s, and you'll see a much more subtle decline with age in terms of changes in the semen analysis parameters.
IVF is only for people who can't get pregnant at all.
IVF has many options. So you can utilize it for fertility preservation. You can utilize it for genetic testing on embryos if both parents are carriers, for instance, for cystic fibrosis.
Can't get pregnant while breastfeeding.
You can get pregnant by breastfeeding. So in theory, breastfeeding can sometimes inhibit our brain hormone access and then therefore prevent ovulation. However, some people, depending upon their own body and how much they're breastfeeding, will still get periods, therefore will still ovulate while breastfeeding. So that is a complete myth.
IVF is painful and dangerous.
So the complication rate of IVF is actually really low. With the egg retrieval, it is a procedure, but complication rate's way less than 1%. So it is a fairly safe process and procedure.
If you've already had one child, you'll never struggle with fertility.
Unfortunately not. So I see just as many patients that have children are now having fertility issues. We call it secondary infertility. And I see just as many of those patients as patients who haven't had a child yet, which would be primary infertility.